Arousal refers to a psychological state. Arousal can be described as the degree of energy release and the intensity of readiness the performer or as drive or excitation. Arousal is a necessary ingredient in sport performance, although its level can wither, facilitate or hinder the execution of specific skills or task components. Examples within the case study are when Paula was at the 5-minute mark of the race, where she focuses on the back of the teammate. Then at 6 minutes, Paula has an unexpected surge of energy, using the resources which she has trained for, and the pain disappeared and the pain felt good. She reaches optimal arousal, which is crucial for her performance. Anxiety is a negative emotional state that is either characterised or associated with feelings of nervousness, apprehension or worry. Anxiety can either be in the domains of cognitive or physiological. Within the case study, Paula is looking across at the other boats and thinking they are bigger than her crew. This is a cognitive aspect of anxiety, and 1 minute into the race, when her muscles begin to hurt, this is the physiological state. State anxiety, a brief, ever-changing mood state that is an emotional response to any situation which is considered to be threatening. Examples from the case study are when Paula pre-race has a fear of letting her team down as it's the championship race, and Jill as it is her final race. Her state anxiety would be high, and just before the coxswain called out for the crew sprint, and as she stated, heard the coxswain call what she was dreading. Train anxiety arises in response to a perceived threat, but it differs in its intensity, duration, and the range of situations in which it occurs. If an individual has high levels of train anxiety, then they become worried in situations, whether they should find the situation worrying or not. Example of train anxiety from the case study is that when Paula has been thinking about the race since the beginning of the season. This constant thinking about the race would increase Paula's state anxiety when the race finally happens. After the race, she kept thinking about it and was worried what Jill would think, although Jill may potentially have never blamed Paula for the race. The hypothalamic pituitary adrenal axis, the HPA axis, responds to stresses which are perceived as threat to the homeostasis of the individual. The HPA is comprised of the hypothalamus, the anterior pituitary gland, and the adrenal glands, which is the foundation of the neuroendocrine system. The neuroendocrine system is a combination of the nervous system and the endocrine system, which we rely on. And we rely on this system to send messages throughout the body as chemical signals, which are in the forms of hormones and neurotransmitters. In response to stress, the HPA axis starts in the hypothalamus, releasing corticotropin-releasing hormone, CRH. CRH then travels to the anterior pituitary gland, which secretes the hormone adrenocorticotropin hormone, ACTH, into the bloodstream. Via the bloodstream, ACTH causes the cortex of the adrenal glands to release stress hormones, but most vitally, the glucocorticoid steroid hormone cortisol, which increases the accessibility of the body's blood supply, metabolism of carbohydrates, fats and glucose in response to stress. The release of cortisol is controlled by a negative feedback loop, where when the levels of cortisol increase, that inhibits the release of CRH from the hypothalamus, thus the release of cortisol is inhibited. In relation to stress, the HPA axis initiates several behavioural and physiological changes to the release of cortisol. Behavioural effects in response to stress include increased awareness, improved cognition, excitement and absence of the sensation of pain.
Any given skill level, performance depends on arousal or drive in a simple linear way, such that the greater the arousal, the better the performance. An example of drive theory from the case study occurs in the 5-minute mark of the race. Paula had been struggling throughout the race, but hears the coxswain call for a sprint as they approach the finish line. She begins to focus on the task at hand, getting 37 strokes per minute, then 38 per minute, 39 per minute, and then 40 strokes. Once she'd started to focus and realise that the finish line was in sight, and set herself a goal for the rest of the race, which was improving strokes per minute, it provided her the drive to give it a final push to the finish. Equates low levels of arousal with poor performance. As arousal increases, performance improves until an optimal level of arousal is reached. Beyond this peak, an athlete is over-aroused and performance deteriorates. The basic principle is that low arousal equals low performance levels, but too high arousal also equals low performance levels. In this case study, Paula was extremely concentrated on what was going to occur in the race, and in the early stages of the race was putting all the effort she could into her strokes. However, the response she got from this was not the one she's used to. Paula has gone beyond the optimal level of arousal, the peak of the U if you were to look at the diagram, and this caused her performance to decrease. The individualised zone of optimal functioning is similar to the inverted U theory, except that the optimal level of arousal does not occur at midpoint. It focuses on finding the zone of optimal arousal for individual athletes. It is suggested that by monitoring an individual's anxiety levels prior to several competitions, it can be established at which range good performance occurs. This range would constitute their zone of optimal functioning.
Multi-dimensional anxiety theory claims that the connection between performance and anxiety takes a different form for the two different types of anxiety. Cognitive anxiety relates to the worry about not coming up to expectations, which can cause a lack of ability to concentrate. Somatic anxiety relates to the physiological arousal, and it's reflected in the responses of elevated heart and breathing rate, shortness of breath, butterflies in the stomach, and tension within the muscles. The multi-dimensional anxiety theory hypothesizes that there is a negative linear relationship between cognitive anxiety and performance, and less influential inverted U relationship between somatic anxiety and performance. Example from the case study on the multi-dimensional anxiety theory is the cognitive thought from Paula is at the 3 to 4 minute mark of the race, Paula kept on having negative thoughts in the middle of the race, which was interrupting her attention, and the harder she tried, the worse it got. This is showing the negative linear relationship between cognitive anxiety and performance, as the more she kept having negative thoughts, the greater decline in her performance. Catastrophe model shows the relationship between cognitive anxiety, physiological arousal, and performance. The main prediction of catastrophe theory is that when cognitive anxiety is high and goes beyond the optimal point of arousal, then decrease in performance or catastrophic effects of performance occur. Once an athlete does have a catastrophic, it is very difficult to recover, and small reductions in arousal won't bring performance back to its previous levels. The athlete must reduce arousal levels below the point at which catastrophe occurred. Examples from the case study of catastrophe theory is the behavioural at the 1 minute point of the race, where Paula was putting all her strength into each stroke. This is putting her out of optimal arousal zone, thus causing her muscles to hurt and feel weak and exhausted, which causing a decrease in her performance. Paula's increased effort, which causes her to go out of the optimal arousal zone, would be due to her increased cognitive anxiety, as it was higher than normal before the race had commenced.
Reversal theory is a psychological theory focusing on motivation and emotion. Reversal theory is organised into 4 main areas or domains in which each has 2 opposing motivational states. These states are known as paratelic and telic. With arousal in relation to the 7-day graph, individuals who participate in physical activity may potentially not be able to reach the optimal arousal levels they need to participate effectively. Children will react attending physical activity participation per week as it doesn't arouse them enough individually, or it over-arouses them and they lose interest in participating. Children attend team activities for longer periods of time as they can get a sense of excitement with participating with their friends and perceive longer than individual activity.
Depending on the type of motivation, it will help determine how long individuals will participate in physical activity. If a child is more extrinsically motivated, then they will not only participate for a couple of days if rewards are not constant and pleasing, such as chocolate or playing enjoyable games. However, if a child is intrinsically motivated, then they enjoy seeing improvement and will want to constantly get better, thus they will participate in physical activity more frequently.
Observing the data, it is clear to see that Paula is in a paratelic state. We determine this due to her observation, i.e. looking at others across the river, she noticed they were all bigger than her. This shows us that she is already falling into trait anxiety and feelings of high arousal, due to her wanting it to get over and done with. Between her meta-motivational states based on how she views her arousal throughout the race. At the beginning of the race, we can see that Paula was highly aroused based on her viewing it as an unpleasant anxiety, resulting in her negative thoughts. This is also represented in this graph that shows a high peak in her prefrontal cortex on the right side, which also indicates negative thoughts. It has also affected her physically, making her extremities feel cold, changed as Paula continued on to the end of the race. This is where she started to view her high level of arousal differently by switching her meta-motivational states. She began to focus on a task at hand rather than the performance of a team or the outcome. Around the 5 to 6 minute mark, Paula's prefrontal alpha left cortex wave activity is peaking and the right side has dropped, which indicates positive thought due to her arousal being viewed as a good